Time you entered the room, take general examination of this patient. Start.
Okay. I entered the room with a agreed to examiner and give my mark sheet, and with a smile, I agreed to the mother. What is the name of the mother or child?
Mother is Salma and she is suppose Rocky. Rocky is 14-year-old
Rocky.
boy.
So I also greet to the mother. Good morning, Salma, and hi, Rocky. I'm.
Hi.
I also. I. At the meantime, I also wash my hand and also look at the surrounding, any type of device present or not, and I also uh, take a permission from the mother. Je, I am Doctor, one of the child doctor of the hospital. I want to. Will you kindly allow me to examine the Rocky?
Okay, so device she is wearing a specs on her eye, on his eye, and this.
Okay. So I look up the Rocky first. I see that he's a very tall child, having a
Hmm.
spect in which are also present,
Also hearing
and
aids.
also hearing aids also present. Then I ask the Rocky, Rocky, will you kindly give your hand, please? Then I start taking his hand. I'm seeing that the
Okay.
hand is of the long hand have long cylinder finger, and also ask the Rocky, Rocky, will you kindly encircle the other hand with this hand of the other wrist? I see that he can easily perform with the overlapping of the little finger and the thumb also. And I
Hmm.
also tell the Rocky to demonstrate myself to adapt the thumb to the opposite side so that it can be visible from the opposite side actually, which is commonly known as the state back signs. Then I feel the pulse, whether the pulse is rate, rhythm, any changes of the volume of the pulse.
Yeah,
Uh,
pulse is normal.
okay. Then I see whether there is any features of any pallor, any jaundice, any type of clubbings, and any
No,
features of
no,
any bacterial endocarditis present or not. Then I go
no.
upward to the elbow joint. I see that whether the elbow joint can be extended normally or it is restricted in positions, mild restricted of the elbow joints. Then I again go upward to the face again. Again, I already see that he's already on hearing aids and on the spect and long senior finger. Then, Rocky, will you kindly open your mouth, please? He's open
You
his
open
mouth.
mouth.
Is there any higher palate or crowding of the teeth, or any sinuses or pallor is present?
Yes, he has high arched palate and that is overcrowding teeth,
Okay.
dental
Oh,
abnormality present.
okay. Then I asked the mother, Fatima, will you kindly just expose his chest just a little bit? Then
Hmm.
expose of the chest, I will expect that whether any features, any standard malformation, is pectus excavatum or carinatum present or not. Is there
Yes,
any
pectus excavatum present and there is some capillate spots present.
okay, capillary spot present in the chest one. No? At the same time, I
Hmm.
also look whether in the picoidium any bulging or obvious pulsation present or not. At the same time, just
No.
while he exposes, okay. Then I come downward to see. I'll just Fatima, please will you kindly allow me to see his back. In the back, I'll try to notice is there any features of any scoliosis or skyphosis present for the vertebra or not.
Yeah,
Is there
there
any
is scoliosis present.
scoliosis present? Okay. Then I come downward in the legs. I also feel the pulse and also note the same features like pallor, sinus, jaundice, clubbing, any features of bacterial endocarditis, and also should want to like the sole, whether there any features any pes planus or the sole is present or not.
Testosterone
Then
is
I asked
present.
the Rocky, just we can make a walk for me, please. He
He's
walking.
walking.
And now Aksta, I demonstrate himself without keeping the knee joint in straight, actually, without any flexions, whether he can touch his both palm into the floor, actually, whether it is he can
Yes,
performing or
yes,
not.
yes, he can do that.
Okay, so that
Yes.
okay, ma'am. Uh, okay, then anything I'm missing and make up the screen.
Okay.
So
So
I would like to
describe.
however, no, I would love to complete my examination with plotting weight and height and appropriate growth chart, and also performing his arm spans also. and also do an ophthalmological examination of his eyes, and the detailed cardiovascular examinations. So today I examined Rocky, who is 5-year-old probably girl, who is shown with thin, long cylinder with features of any Marfan, like Marfan have features, having long cylinder faces, having spectacles, and also hearing aids. In the hand, we features long cylinder fingers and other features of Steinbach signs, and his sign is also positive. Although his pulse volumes is normal, and there is no features of any bacterial endocarditis, pallor, and jaundice, and clubbing also. However, he has pectus excavatum is present, and in the back, possibly scoliosis is not no deformity of the vertebra is also present. No. In the leg also, that is space planus, and however he also touch his finger, touch his palm into the sole, indicating that he has hyper flexibility, hyper extensibility of the joint is present. So consisting all the features, possibly he has the features of Marfan symptoms.
Okay. So this is a Marfan syndrome. What investigation you do?
I want to perform a genetic test, confirmation of the diagnosis, genetic testing to detect any fibrin gene defect present or not. And as this condition is mainly presented with other cardiovascular abnormalities, especially aortic dilatation and mitral valve prolapse, as well as there is chance of less dislocation. So I'll also refer the case to ophthalmologist to perform the ophthalmological examination to see the lens dislocation present or not. And anything,
Any advice you want to give?
I will advise, as there is joint laxity is present, so we should not perform any strenuous activity. You should do in close monitoring with a cardiologist and also ophthalmologist regarding advice.
Okay. So why chest pain occur in Marfan syndrome?
Chest pain can occur in if there is as there is aortic dilation, chance of aortic dissections. So in that condition, there is chance, and also in mitral valve prolapse, also causing some palpitation, also chest pain also, madam.
Okay. Thank you very much for your participation. So that is a 12 stager general examination. What I know in general examination, we enter the room, give the mark sheet with smile, then do the general examination. They will tell me. I just make a report the mother and the child. Hello. That time I notice the general condition of the child, like his distress or not distress, measurements, tall, short, obese, not obese, then mentality. When I'm making the repo, his mentality is submental or not, and puberty started or not, significant or surrounding any syndromic features. Okay. After that, what is the procedure? We do the GB, LBGM. L means I will notice the leg. I will go the, uh, I will see the neck of the child. If neck there is any thyroid, I will ask the my examiner. I want to do the thyroid examinations, or other I will go the leg. I will see the leg. I will go the back. So general examination that can be cutaneous syndrome come. So leg, I'll back. Then we'll tell the child for gait. Please walk in front of me. He will walk. On walking, we can find genu recurvatum in Marfan syndrome. Also, we can find the pes planus. And when I check the back, we can be find any scoliosis or kyphoscoliosis and capulate spot. These features we can find. So leg, back, and gait I have seen. Then measurement. I will tell him to stand on the wall. His buttock, his shoulder, everything touch the wall. Then I can take the help from the mother. Please hold this measuring tape. I will measure him. Both his standing height and sitting height. When he will be sitting height, I will tell. I will give a file on under him, and he will sit on that. Okay, again, touching his like his shoulder on the wall. Then both standing height and sitting height I measured. I will know that that is a proportionate or disproportionate tall stature. So proportion, disproportion, we know that total height divided by 2. If it is more than 7 going, then that is proportionate. Okay. After that, I will go start my target general examinations. Like this is a short, tall stature. So tall stature, go by tall stature. Starting from the hand, we can find long pay. There is arachnodactyly present, and the thumb sign, Steinberg sign, and the Walker sign, wrist sign. And also I measure the pulse. Pulse here can be water hammer pulse or hyperdynamic circulation, because there is a heart disease related to that. After that, go on the eye. In eye there is ear. Then go the mouth. Mouth, what we are finding: overcrowding teeth, dental abnormality, and high arched palate. These are. and in eye you can find specs and the glasses. Then we go the CVS. General examination, we can do anything. Here we can just auscultate the heart if we wish, because we know that Marfan can be found. After that, we go the Byton score maneuver. Byton score maneuver needed in Marfan syndrome. Once I will ask the child to pull his skin of the neck, because Ehlers-Danlos syndrome also we are checking. That is one of the important differentiation DD of the Marfan syndrome. So after that, I will Byton score. Byton score is 9 marks. If it is go more than 4, that is we will tell hypermobile the child. Byton score, how can we do? 6 on the hand. That is he distend the elbow, then that is elbow will be go. Then also the thumb, also the um small finger. We check 6, and also from the leg, January curvatum 2, and bending of this back. That so 9 mark 4. After that examination, understand,
Okay.
Doctor
Okay.
Byton's score. You also did nicely. Actually, you start from the hand, go, and at the end you leg back. Did you do? So I think
Okay.
you have any other performa you follow.
Okay.
It's okay. General examination you can do anyway. Any other way you can go, but that is. So Marfan syndrome, I tell you the features already. That is pes plana, genu recurvatum, scoliosis, kyphoscoliosis, capillary spot on the gait and back. Headache, thin, long face, high axe palate, dental abnormality, that is overcrowding, supporting aids, that is hearing aids and glasses. And hand, what we find? Rhabdodactyly, positive Steinberg sign, that is thumb sign,
10 days.
positive Walker sign, that is wrist sign, pulse abnormality, that is water hammer pulse plus equal hyperdynamic circulations. And also,
Okay.
there is scar mark can be present. Why scar mark? Because of tension pneumothorax. Any
Oh,
chest
actually,
deformity, pectus excavatum, and perineum. If you ask me the scar, I will tell you that there is a scar
okay.
present.
Yes.
Capillary spot or bruises, because it is a collagen disease, easily bruises. I would like to
Okay.
complete my examination by formal hearing assessment and Byton score for hypermobility. If you can't do the
Oh,
Byton score, you just mention. I will complete my examination this.
just
That you
compliment.
know that Byton score I
Okay.
can needed. And I would like to
Thank you.
ask the mother about other family member with the same condition or not, because
Yes. Yes.
Marfan
Yes.
syndrome is an
Autoimmune
autosomal
dominant.
dominant
Mm.
condition and fibrillin gene chromosome number 15. Now about the investigations. So investigation is fast. In clinical, there is no time. I will tell the diagnostic. That is genetic test, fibrillin gene, chromosome number 15. Lab is
Okay.
nothing needed. Imaging, we do the spine X-ray, MRI spine, because we find dural ectasia. Echo must needed because aortic root dilatation or mitral valve regurgitation. Plus formal hearing assessment plus slit lamp examinations for lens dislocation. The lens dislocation is upward and inward. My management plan, I will involve my multidisciplinary team, that is cardiology, ophthalmology, geneticist, lies with the school, occupational physiotherapy, ENT, thoracic surgeon, family psychological support. These are. Now advice. So advice, there is chest pain because heart disease. So if anytime any chest pain, ask medical advice immediately. Follow up with
Okay.
the cardiac doctor to measure the aortic dimension and plot him on the center. And for hypermobility, some advice we give. What is that? Number one, strengthening the muscles around the joint. Swimming is good and avoid exercise that cause additional stretch on the joint ligaments. Attention should be paid to appropriate footwear and awareness of the posture to prevent the development of chronic pain, and use wider pencil as easier to grip. They have difficulty grasping pens or pencils. So one is cardiac chest pain and cardiac doctor monitor. And for hypermobility thing, three thing, that is muscle strengthening exercise like swimming, then
Yes.
appropriate footwear because he has pes planus. And number
Okay.
three, wider pencil because his finger are long.
Oh, so why did pencil?
These
Okay.
are advice we give.
Oh,
And the three sign, remember thumb sign, that is Steinberg sign, wrist walker sign, WW, wrist walker. And chromosome
restart.
15, also present chromosome 15 in Prader-Willi syndrome and Angelman syndrome.
Yes.
And why the cause of chest pain in Marfan syndrome? Cause of chest pain in Marfan syndrome is spontaneous pneumothorax and dissection of the aorta. So
Oh,
important in Marfan syndrome, they always ask you homocystinuria. So
no system.
homocystinuria is one of the DD. So how can you differentiate? Because Marfan syndrome, there is hypermobility. Homocystinuria, there is contracture present.
Restriction. Contraction. Yes.
That is very important. Another is Marfan syndrome, autosomal dominant recessive. There is a long list. Normal mentality, Marfan, and submental is homocystinuria. So these are a list, and homocystinuria is according to, I will tell. Like investigation is genetic homocysteine in the urine, or we do the coagulation profile, ultrasound abdomen, DEXA scan for osteoporosis, slit lamp, fundus atrophy. And treatment is I will give the folic acid, vitamin B6, vitamin B12. If not responding, biotin and diet is low in methionine. Improve lens dislocation, seizures, and learning problem, experience stay. Follow up by homocysteine level in fibroblast, ophthalmology DEXA scan. And these are so homocystinuria. Also, you need to study in Marfan syndrome. One or two questions they will related us. Also, if they want, they can take you Ehlers-Danlos syndrome because so Ehlers-Danlos syndrome there is skin elasticity absent. So this is all about. Thank you very much everyone for participation.